Your patient's diet might be the secret culprit slowing down their recovery. Surprised? So, does diet affect PRP? As orthopedic surgeons, we don't usually talk about gut health or food or anti-inflammatory diets, but here's a bold take. If you ignore gut inflammation connection, you could be sabotaging your patient's treatments. I'm Dr. Ariana DeMers, the Queen of Business Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. Orthopedics meets nutrition. Let's unpack the gut inflammation axis and why it's important for recovery. We'll see how unhealthy gut or dysbiosis or leaky gut raises systemic inflammation via LPS leakage, slowing tendon and joint healing. I'll show you how diet affects PRP outcomes while anti-inflammatory eating primes the body for repair. You'll see recovery is as much about the internal environment as the procedure itself. So how does gut health affect orthopedic recovery? We all know inflammation is a major driver of joint pain, arthritis progression, and poor healing. But here's where it gets really interesting. The gut is one of the biggest sources of inflammation in the body. When your gut is healthy, the intestinal lining acts like a secure border, keeping nutrients in and keeping harmful substances out. But when there's dysbiosis, an imbalance of the gut bacteria, or something we call increased intestinal permeability, also known as leaky gut, harmful compounds like lipopolysaccharides, or LPS, can leak into the bloodstream. These LPS molecules are potent triggers for the immune system and systemic inflammation. And that inflammation doesn't just hang out in the gut, it's systemic, including the joints. So if the patient is dealing with chronic gut inflammation or leaky gut, you can expect that you're going to have slower tissue repair, more swelling, more pain in the joints. For us orthopedic surgeons, this means that we can't just look at the knee or the hip or the shoulder in isolation. We really have to look upstream. And we have to consider the gut as a potential driver of inflammatory load. So, does diet affect PRP? The short answer is absolutely. As we all know, PRP works by concentrating the platelets and then releasing the growth factors to stimulate healing. But those platelets come from the patient's own blood. So the quality of their diet directly influences the quality of their platelets. If someone's diet is loaded with refined sugars, processed carbohydrates, omega-6 heavy oils, this is fueling chronic inflammation. And their platelets will reflect that inflammatory state. And you may see less than optimal healing after injections. And not only because of the tissue, but the platelets themselves. On the flip side, patients with nutrient-rich, anti-inflammatory diets are now creating platelets that are primed to be able to repair. So think of it like planting seeds. If you're planting them in healthy, fertile soil, you're going to see stronger, faster growth. The same applies for PRP in a healthy internal environment. And so this is why I tell my patients and the doctors I teach that nutrition isn't extra. It's part of the program. It's foundational. So what nutritional strategies do I use to optimize PRP results? So let's talk about the action steps, what you can actually recommend to your patients, or even integrate into your pre-procedure protocol to give PRP the best chance for success. So here's my top strategies. Number 1 is reduce pro-inflammatory foods. Cut back on refined sugars, processed carbs, deep fried foods, industrial seed oils like soybean, corn, canola. These all can spike inflammation and counteract the healing that we're actually trying to achieve with PRP. What I tell my patients is if it's hot pink or comes in a package, you should not eat it. So, step 2 is increase anti-inflammatory foods. So we emphasize omega-3 rich foods like salmon, sardines, chia seeds, walnuts, load up on those colorful vegetables, berries, and herbs like turmeric and ginger because they're packed with antioxidants that help neutralize free radicals. And then the next step would be to support that gut microbiome. I always encourage fermented foods like kefir, sauerkraut, unsweetened yogurt. Increase the prebiotic, which is fiber, and the probiotic, which is beneficial gut bacteria. So increase dietary fiber from vegetables, legumes, and seeds. This is the beneficial bacteria's favorite nutrients. Next, make sure that your patient is getting adequate protein. Tissue repair requires amino acids. So patients should really aim for high quality protein sources, wild-caught fish, pasture-raised poultry, grass-fed beef, or even plant-based proteins if preferred. And make sure they're getting enough. Really do the calculations to make sure that they know what their daily goal of protein should be. And then, of course, stay hydrated because hydration supports blood volume and nutrient delivery to healing tissues. And yes, even platelet function benefits from adequate hydration. So when patients start using these habits, even a few weeks before their PRP procedure, we often see better recovery times, less post-procedure pain, and longer lasting results. Gut health and nutrition are not side conversations. They're central to optimizing the outcomes in orthopedic and regenerative medicine. If we want PRP to work at its full potential, we have to address the environment it's working in. By bringing these conversations into patient care, whether through education, handouts, or even a simple pre-procedure checklist, you're not just doing PRP, you're setting your patients up for true joint health. If you want a step-by-step framework for integrating PRP into your practice, I cover all this and a whole lot more in my Orthobiologics Masterclass, PRP Now. Because at the end of the day, I don't just teach PRP, I teach freedom. So subscribe to my newsletter and stay updated.